Good afternoon. My name is Tanya Kearney, and I am a social worker. I am a renal social worker, and I work at a dialysis clinic. I've also worked with people who are not on dialysis. Maybe they're in the hospital setting and learning that they have kidney disease. And I've also worked with our chronic kidney disease program. I've been a renal social worker for about 20 years now. So thank you for being here this afternoon. We are going to start by going over coping with and paying for kidney disease. So everyone who goes to a dialysis clinic or who has had a kidney transplant will have a social worker. And your social worker will have a master's degree in social work. They will have counseling skills to help you cope with your illness, navigate the healthcare system, advocate for yourself, get physical rehab, emotional access to resources that can help you with coping, and access financial help as needed and available. Your social worker will know about many resources. These resources include treatment-related transportation, programs to pay for drugs, food assistance, and independent living, financial help, and help with housing and low vision, dental, and hearing services. So we're going to talk about coping with kidney disease. So when people find out that they have kidney disease, they are liable to feel any number of emotions, and it is all normal. It is normal to feel depressed, anxious, sad, shocked, denial, to maybe have fears or concerns about being able to maintain your independence, and to have questions and fears about how to meet your financial needs. So for people who have been on dialysis for at least 15 years, they tend to have many shared beliefs that help them to cope with dialysis and to do well on dialysis. Many believe, I want to live. And in order to cope, they write down what they're grateful for, they live for more than dialysis, and they ask for support. They also tend to feel that I am still me. They think positively. They don't define themselves by their illness. They make time for non-dialysis related activities. They feel I am still valuable. They do what makes them feel worthwhile, and they own their successes and appreciate who they are. And they believe I am in control. They know their options, they seek information, they ask questions and take control where they can. So one of the best things that you can do if you're faced with kidney disease and having to do some type of treatment for it is to, number one, just try to choose to have a positive attitude. It can be very difficult, but having the proper mindset can really help you as you're dealing with the course of your illness and determining what it is that you want to do about it. So if you find that you are sad for 2 weeks or more, be sure to ask for help. And you can expect to have ups and downs. No one is going to have the same mood every single day of the week. Dealing with medication changes, doctor's appointments, and just physically not feeling well at times is going to make you have ups and downs with your mood. Write down one good thing about yourself every day. Do something creative and try to avoid self-destructive behaviors. Live for today, but always try to set future goals for yourself. When you need help, there are a lot of people that you can ask for help. Your social worker, other mental health professionals, your clergyman. There are many outreach and support organizations out there that you can access. Your family and your friends, that will be very important, just to remain close to them, talk with them, confide in them about how you're feeling. There are also a lot of community agencies, and if you're not sure which community agencies to contact, again, speak with your social worker. They're usually going to know what's out there. One of the other things that you really should consider is seeking help from others who are dealing with kidney disease. You can attend classes and support groups. You can ask for a mentor. You can use trusted social media And you can always research new options. And please, whenever you use these resources, follow up with your treatment team just to confirm that you're getting good information. Some of the things that you might want to speak with your support system about would be just how you're feeling emotionally, how you feel physically, how your kidney disease affects you and your loved ones, how you can work together to meet your goals. You should also consider having an advance directive. So, a living will is an advance directive, and it states what your wishes are regarding life support measures. You should also consider having a durable power of attorney for healthcare decisions. This document names someone to make decisions for you only in the event that you can't make your own decisions. You can find state-specific forms at www.caringinfo.org. One of the other things that can come up when you're dealing with kidney disease are concerns related to sexuality and intimacy. You can always speak with your social worker or your physician about these concerns. This is, again, a very normal thing to happen. Your physical condition, maybe medications, or just the emotional stress of what you're dealing with can certainly cause changes in how you're able to express intimacy. So talk with your doctor, your social worker about relationship issues, any concerns that you have about your body image, changes in your sexual interest or functioning, and any desire that you might have to have children or any type of family planning issues that might come up. One of the things that I encourage for people who are dealing with kidney disease, who might be on dialysis, is to try to stay as active as you can. It is very important to try to maintain some sense of normalcy in your life. So if there are activities that you enjoyed before you started dialysis, by all means, if you are physically capable, try to keep doing those activities. Other things that you can try might be to work or volunteer, go to school, you can exercise. If you don't have a hobby, this might be a good time to take one up. So, because you don't want your whole life to be focused and centered around your dialysis. So, some of you may have questions about how to choose a treatment. Most will have many options when it comes to treatments. You can do more than one type of treatment, or maybe even all types of treatment during your course of treating your kidney disease. These range from home options, in-center options, and of course, kidney transplant. When you're trying to decide which option you want to choose, you should certainly weigh the pros and cons of each. A really good interactive tool can be found at mydialysischoice.org. You should speak with your physician about your lifestyle and your goals. And if you're thinking you want a transplant, talk with your doctor about how you can go about getting on the transplant wait list, or how you would go about getting a kidney transplant. You may also be able to use a living donor. So definitely speak with your physician about that. One of the other things you can consider if you're looking at in-center dialysis is maybe touring a dialysis clinic. Many are very open to allowing people to tour their facilities, talk with the staff, and if you have the opportunity, try to speak with other patients who are on dialysis to find out what the experience is like for them. While you're there, you can talk with the staff about their rules and their expectations of their patients when they come in for their treatment. Some of the things that you should consider when you are choosing a treatment, you really need to think about your lifestyle. What's important to you? Is it important for you to be able to maintain a schedule that allows you to go to work or go to school? How is this treatment going to impact your sex life? How is it going to impact your ability to do things like swimming or even bathing? Because different types of dialysis accesses may impact whether or not you can take a bath. You might want to know, can you have your pets with you while you're doing your treatment? How much of a need for control do you have in doing your dialysis? What activities do you like to do? And how is this treatment choice going to impact your family? You should also consider things like fertility and if you are going to have a need for childcare or possibly even adult care while you're doing your treatment. You should also consider your treatment goals. What treatment can help you to feel well from day to day? What's going to help you to sleep as well as possible? What's going to give you the best chance for getting a kidney transplant? What will allow you to avoid taking as many pills? What will protect your heart and your bones and your joints? And what type of treatment will help limit hospitalizations? And what's going to help you to live as long as possible and as best as possible? What's really going to fit in with your lifestyle? So many people like to travel. That's something, again, if I have patients who travel and they want to continue to travel, I encourage them to do so. I want you to do the things that you normally do. And if travel is one of them, go for it. So if you're doing in-center hemodialysis and you want to travel, you would want to be sure to arrange in-center hemodialysis at your destination about 30 to 60 days ahead of time. The same holds true if you're doing standard home hemodialysis. If you do next stage home hemodialysis, you can actually take your machine and your supplies with you. If you're going to be doing an extended stay, you might need to have some supplies shipped to your destination ahead of time, but this can certainly be done. The same holds true for peritoneal dialysis. If you do CAPD or CCPD, you can take your machine and your supplies with you. You may need to arrange to have supplies delivered, again, if you're going to do an extended stay. If you normally do CCPD at home, then when you travel, you might be able to do CAPD. If you have a kidney transplant, then you want to be sure to ask your transplant facility if you need to make any changes regarding your medications because of time zone changes. Your team can help you travel. If you're on dialysis, you would want to ask your clinic staff, who can help me travel? Who can help me make these arrangements to travel? That person should also be able to help you find out what the cost and your insurance coverage will be while you're traveling for your dialysis. If you're traveling in the United States, your Medicare will provide coverage for your dialysis treatments just like it does at your home clinic. And for anyone who is traveling, again, you would want to ask if time zones might affect your drug schedule. You want to travel with records, with your drugs, with any needed supplies. And as much as we want you to have a good time, don't take a vacation from your diet, your medications, or actually getting your treatment. So we have a special message for our caregivers out there. First of all, thank you so much for your support and encouragement. Your loved one really needs this. They need an advocate. They need someone to be in their corner. And the treatment team really appreciates having you there to help your loved one out. As much as we know you love them and you help them, you also need to expect them to do everything that they're able to do. So if there are chores around the household that they can't do anymore, maybe trade chores so that they can still be an active participant in the household and contribute to the household needs. Trade tasks if necessary. For you as a caregiver, please continue to do what you enjoy, even if the patient doesn't want to go along. Sacrificing your life can sometimes make people angry and resentful, and we really don't want that to happen. We want you to eat healthy, exercise, get checkups, and really do everything that you can to reduce your own chances of getting sick. We want you to stay healthy, number one, just so that you're taking care of yourself, but number two, so you can be around to keep helping take care of your loved one. If you need help, please reach out to your team and ask for help. we consider caregivers to be part of the treatment team as well. One of the resources that you can also check online is called caregiver.org. Paying for treatment. So there are several options to help pay for dialysis treatments. You can use Medicare with or without a Medigap plan. You can use an employer group health plan with or without Medicare. You can use individual health plans either on or off the insurance marketplace, or you can use Medicaid with or without Medicare. So you qualify for Medicare if you are age 65 or over with enough work credits to get Social Security or railroad retirement. You can call Social Security at 1-800-772-1213 just to make sure that you have enough credits. If you receive Social Security disability for at least 24 months, you will also qualify for Medicare. If you are in kidney failure requiring dialysis or a transplant and you have enough work credits, or if you are the spouse of a child of someone with enough work credits, you can also qualify for Medicare. So, what is Original Medicare? Medicare Part A covers hospitalization and inpatient services. If you have enough work credits, you don't have to pay anything for your Part A benefits. If you are age 65 or older and you don't have enough work credits, you may be able to pay to get both your Part A and your Part B. There is a deductible with each admission unless you are readmitted within 60 days. And sometimes if you qualify, the state may pay your deductible for you. So Medicare Part B covers outpatient services. This would be things like your doctor's visits, any type of outpatient services that you get. Dialysis would be considered an outpatient service. There is a monthly premium for your Medicare Part B. There is also an annual deductible and coinsurance. And again, if you qualify, the state may pay some or part of those out-of-pocket costs. So some of you may have heard of these Medicare Advantage plans and might be wondering exactly what are those? These are also called Medicare Part C. You may have also heard Medicare an MA plan. These plans are sold by commercial insurance companies. They cover at least the same thing that Original Medicare covers. And some may also include additional benefits to help cover vision and dental and some of your prescriptions. The trick with these plans is that they work in provider networks. So you would want to make sure that your physicians, your dialysis clinic, your transplant facility are all within their provider network. They may also limit the amount of drug coverage that they provide. One of the other tricks with these plans is understanding that you will have an out-of-pocket cost, usually a deductible or a maximum out-of-pocket. And this can be up to about $6,000 to $7,000 a year. In addition to that cost, you will also still be responsible for paying your Medicare Part B premium. One thing to consider is that you may have less out-of-pocket cost if you use Original Medicare and purchase a Medicare supplement or Medigap plan to go with that. One thing that you might do is speak with an insurance broker or even contact your state's health insurance department to kind of determine which might work better for you. If you have a Medicare Advantage plan, you can only get out of that at certain times of the year. And when you do, you might not be able to get a Medigap or Medicare supplement to help cover the cost of your medical care. So if you have Medicare, but you don't have any other insurance, you will find that you have deductibles and copays that will have to be paid. In Missouri, Illinois, and Kansas, you can buy a Medigap or Medicare supplement plan to help pay all or most of your out-of-pocket costs if you have a Medigap plan. Please be aware that when you get your Medicare Part B, you have 6 months where you can purchase a Medigap plan and you cannot be refused. If you try to get your plan outside of that 6 months, they might refuse your application. Please be sure to ask your insurance department if you have other guarantee issue rights. So when does Medicare start? If transplant is your first kidney treatment, your Medicare coverage will begin the first day of the month of your transplant. If home or self-care dialysis is what you choose to do, then your Medicare will begin the first day of the month dialysis starts if you start a training program before the 4th month of dialysis. If you start with in-center hemodialysis, then your Medicare will begin the first day of the 4th month of dialysis. So once you have your Medicare in place, you might be having some questions about how long can I keep this? Well, as long as you're on dialysis and you're paying your premiums, you will be able to keep your Medicare. If you have a kidney transplant, then you can keep your Medicare for 36 months unless you are age 65 or older, or you qualify for Medicare due to disability for a non-dialysis related condition. So some of you may have an employer group health plan. If you do, then if you have an employer group health plan, some of the things that you might want to consider is, does it have affordable premiums and out-of-pocket costs, such as your deductibles, your co-pays, and your co-insurances? What is the out-of-pocket before my plan pays 100%? Is your physician, dialysis clinic, transplant facility, are they all in your health plan's network? Are your drugs covered? And how will it coordinate with Medicare after 30 months? Your employer plan is primary for 30 months from the date that you could get Medicare, whether you take Medicare or not. So why would you take Medicare if you have an employer group health plan? Well, Medicare may cover some things that your employer plan doesn't cover. Having Medicare limits what providers can bill you if they accept assignment. The Medicare premium might be less than your employer plan's maximum out-of-pocket. And your employer plan may not pay as primary after 30 months when Medicare should be primary. Something you really need to remember is that when you get your Medicare Part A, you might want to take your Medicare Part B at the same time. If you don't, then you could be penalized up to 10% per year that you waited to take your Medicare Part B. So if you have a kidney transplant and Medicare is your primary payer, your Medicare Part A will cover your hospitalization, you will have deductible, and you will have co-pays for a lengthy stay. And a lengthy stay would be considered anything over 60 days. It will cover 80% of your anti-rejection drugs. It will cover 80% of your physician costs. And it will cover 100% of your living donor's hospitalization and doctor's visits for a limited time and a 6-month follow-up visit. Okay, so if you are on dialysis and Medicare is your primary payer, your Part A will cover your inpatient stay after your deductible and co-pays have been met. Your Part B will cover 80% of your dialysis treatments, 80% of your physician care, and 80% of your outpatient access surgery costs. Medicaid is state health insurance. It can cover your medical bills, and in some places it can also cover transportation costs. It can also cover some costs for eligible children and families, and sometimes it can cover Medicare premiums and or out-of-pocket costs if you qualify for what is called a Medicare savings program. As of spring of 2018, Missouri and Kansas had not yet expanded their Medicaid programs, but Illinois and over 30 other states had. So the future of the ACA health insurance marketplace is pretty uncertain right now. It is currently available for citizens and those who are in the U.S. legally. It is not needed if you have Medicare or other insurance. And most say Medicare is better if you have that option. You will pay more for Medicare if you delay enrollment. If your income is low enough, you may get premium tax credits and help to pay your medical costs, but not if you have Medicare. Low premium plans have higher out-of-pocket costs. Enrollment is November 1st through December 31st. Some can apply at other times. You can call 1-800-318-2596 or go to healthcare.gov to learn more. So some of the other types of coverage that are available would include COBRA plans. This would be basically an extension of your employer group health plan. If you already have Medicare, then you can get a COBRA plan, but you will lose COBRA if you later enroll in Medicare. The Veterans Administration is another option. They will cover veterans care in VA hospitals and contracted dialysis facilities. TRICARE covers active duty and retired military who have Medicare Part A and B and their dependents. And Indian Health Services covers American Indians and Alaska Natives and federally recognized tribes. So there are several ways that you can get help with prescription drugs. You can always go through your health plan, whether that's your employer plan or some other type of insurance plan. There is Medicare Part D, as in dog. There is Part D extra help if you qualify. There is Medicaid. Some states have pharmacy assistance programs. You can also ask for physician samples and discount drug cards such as RX Assist. There are drug company programs, and you can access those through pparx.org or needymeds.org. And of course, there's the Missouri Kidney Program for those who qualify. So the Missouri Kidney Program helps people who are on dialysis or who have had a kidney transplant with things like their centralized drug program, transplant grants, transportation help, and sometimes even a little bit of premium assistance. They also provide education opportunities throughout the state of Missouri. Social Security also provides help. You can apply in person or online for Medicare, Part D extra help, Social Security disability income, supplemental security income, retirement benefits, and survivor's benefits. You can also ask about programs that can help you work while you're disabled. So one of the things that I encourage to my patients who are employed is that if there is any way for you to keep or maintain your employment, please try to do that for a number of reasons. Number one, it's going to be make you more financially viable. If you get disability, it only replaces a portion of what you earn. So you will not earn the same type of money on disability that you would get if you're still working. One of the things that I encourage them to do if they have a job that they're not sure they're going to be able to keep doing is to maybe speak with their human resources department to find out what, if any, other opportunities might be out there for them to maintain some type of employment with their current employer. One of the other resources that can be very helpful to access is Choose Work. which can be found at choosework.ssa.gov. This is generally available for people who are between the ages of 18 and 64, and you can get information on the Ticket to Work program and find out which employment networks are available to help support you as you're trying to find employment. There are anti-discrimination laws that protect you. Those would include the Rehabilitation Act, the Americans with Disabilities Act, the Family and Medical Leave Act, and the Age Discrimination in Employment Act. If you feel that you are being discriminated against in some way, please get additional information about these laws, and reach out again to your social worker for help or more information. So additional resources that you can turn to for help or support include the American Association of Kidney Patients, the American Diabetes Association, the American Heart Association, the American Kidney Fund, Home Dialysis Central, Kidney School, Life Options, the National Kidney Foundation, UNOS Transplant Living, PubMed.gov, the NIDDK.nih.gov.